as we head out of summer and into the fall. Not only are we keeping up to date on COVID-19 and keeping that in consideration as we head back into the office and send our little ones off to school, we are also focusing on a number of other health issues affecting our families and our community. And for many of us, it's that time to get those routine health checks. Here to help us clear up this mass of information and get our questions answered is Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, thanks for joining us again.
Thank you so much for having me, as always. How you guys doing?
Doing all right this morning. How are you doing?
I'm getting there, slowly but surely.
Yeah, that seems to be the case for a lot of people today after the week we've had so far. Dr. Taweel, we are coming toward the unofficial end of summer with Labor Day weekend just a few days away. And with that, going into a new season, going into the fall, a transition point for the year. That's one of those times when a lot of people should be starting to think about some of those routine medical checkups, or maybe even do think about those routine medical checkups at this time of the year, especially for our kids. What are some of those checkups that parents and individuals that are adults just taking care of themselves as well should be considering getting at this point in time?
Oh, general checkups are always important, whether or not you feel like you have anything wrong. The saying goes, an ounce of prevention is worth a pound of cure. I strongly recommend that you guys get your routine physicals. You guys, you guys being the general public and as well as with kids, make sure vaccines are up to date, not just for COVID, but for all other things. As well as making sure that you're getting your age-appropriate screening. You want to get screened for colon cancer if you're above the age of 45, as the guidelines have just changed those rules. Make sure you're doing cardiovascular screening, lipid profile, make sure you're being checked for diabetes, all the preventable things that you're getting on top of. And if you're female, mammograms, male, prostate checks, et cetera, et cetera.
So for the kids in particular, as they're heading back into school this year with COVID-19, not as much of a factor in the return to school proper and procedurally, but certainly still a factor in the community, as well as spread of other diseases like monkeypox. What additional considerations should parents be making at this time as they're getting ready to send their kids back to school, and maybe even some additional checks that they can make when their kids are coming home to decide whether or not it is best for their kid and, of course, for the rest of the classroom and their school to send them to school the next day?
Well, I think a lot of it's going to be based on a few things. I think a lot of it's going to be based on what the school is going to recommend. I think individual districts are going to make recommendations based on the public health issues that are facing those particular districts. So I think mainly keeping in touch with your school and your administrators to get a good idea of exactly what the big concerns are in those pockets of areas. The other issue is to make sure that your children are up to date on all vaccines. And as monkeypox/smallpox vaccines become more available, I would recommend getting those, recommend staying up to date on COVID vaccines as appropriate. And, again, we're past COVID, but the general rule should remain. The one thing that should have changed for everybody is contact precautions, making sure you're washing your hands, making sure things like that are being done. You are, avoiding intimate contact with other people for prolonged periods of time that you're not fully aware of. Assume everyone has something. I don't mean to make a scare tactic by any means, but that's going to be the best way to be preventative in these situations.
We're joined by Dr. Jamie Taweel from Grand River Medical Associates on today's edition of the Megacast. On the COVID-19 front, case numbers continue to be pretty consistent in terms of how they're coming back from the test positivity that's reported to the state. It's really hanging around, the 15 to 20% mark. Last week, about just over 19,000 new cases reported at the state level. In your office and in our local area here, how much of a concern in the medical community as COVID-19 continues to be, as it still is spreading, but maybe isn't having as severe of an impact on the community as it's had in the past?
So COVID is still there, it's still around, and I'm still getting phone calls when people are getting it. I think as people are getting a little bit more lax, that's when it's kind of striking. My joke is that it's kind of like taxes. It's going to catch up to everybody. I feel that we did a really good job of slowing it down, but what we didn't do was stop it. And that's going to take a lot more, and it's going to take some time. The good news is the particular variant of COVID that's around these days is actually not as aggressive. So thankfully, we're not having hospitalizations, as insane as they were when things first started. People are getting COVID, but they are getting a much milder case of COVID. And I'm not suggesting that that's you don't want to get sick by any means. And again, you want to make sure that you're keeping your comorbid conditions down. You're making sure your blood pressure is controlled, your diabetes are controlled, et cetera. But at the same time, the good news is that while COVID is pretty steady, deaths and hospitalizations are kind of leveling off, which is always a good thing. But I am seeing quite an uptick. It kind of has been coming in waves as far as I see. The vaccines seem to have been helping a little bit. It's not preventing catching it with this particular strain, but it is making sure that things are a little bit easier. Not to mention that the introduction of Paxlovid, which is a COVID pill that's used for the emergency use for treatment of COVID, has been helping patients as well. So if they do get COVID, they are able to get Paxlovid and hopefully help to reduce their symptoms and hopefully reduce any long-term effects.
We're joined by Dr. Jamie Taweel from Grand River Medical Associates on the Megacast. You can get in contact with his office and learn more information by visiting grandrivermedical.com, grandrivermedical.com for more information, or give them a call, 248-264-6169, 248-264-6169 for more information. Dr. Taweel, another concern in the local community, and we just talked about this recently on the show several times, has been monkeypox. It's not necessarily spreading at the rate that COVID-19 is spreading at this moment in time, or has spread in the past, but it's been a growing concern across the U.S. and around the world. It's spread in a variety of places. What sort of questions are you getting at this time from your patients, or better yet, what sort of advice are you giving your patients that may be concerned about monkeypox at this time to be aware of, and where that is at in our communities?
So the majority of the questions that I've been getting from my patients have been basically this: should I worry? and the answer is, you should always be concerned whenever there's something that's kind of becoming a bit of a resurgence. With regards to monkeypox, it is not spread as easily as COVID, thankfully. It does require a little bit more contact, fluid contact or sexual contact, etc. However, that doesn't mean that it's a free-for-all. Obviously, we're seeing cases rise. So maintaining very safe, appropriate contact precautions is going to help the majority of patients. And that's usually what I'm telling people. The other thing I'm telling people is to not discount any type of rash that they are getting. A lot of times these things are going misdiagnosed, and that's kind of how the spread is occurring. A lot of people are thinking that it's something different. Physicians sometimes are confusing it for sexually transmitted diseases, and the ability to get the test for it has been a little bit stymied. So that's kind of how this spread is occurring. But I am telling patients, as long as they're maintaining a little bit of awareness of anything new, rashes, and so forth, as well as maintaining appropriate precautions, safe sexual practices, hopefully this can be a little bit more blunted. And as the vaccine becomes more available to help reduce the severity of the disease, we can breathe a little bit easier, so to speak.
In Oakland County, you can get updated information on monkeypox from the Oakland County Health Division and the Monkeypox Task Force by visiting oakgov.com/health, oakgov.com/health, or of course, contact your primary care provider for more information. We're joined by Dr. Jamie Taweel from Grand River Medical Associates on today's edition of the Megacast. Dr. Taweel, what are some other common issues that you're seeing maybe in your practice, or you're hearing from other doctors in the local community that are affecting patients at this time?
Oh, well, thank you for asking. The good news is that I'm seeing the regular routine stuff. A little bit of airway issues. I'm seeing a lot of patients that have just been developing a pretty nasty cough. COVID has been so mild that people are actually thinking that cases of COVID are common cold. So they're, believe it or not, unfortunately spreading it because they're not getting tested because they don't think it's anything. They feel that if it's COVID, it's going to be severe. And this is a pretty nasty allergy season, and the weather's not been pretty. So there has been some cases where they're getting recurrent sinus infections, bronchial infections. Those are the common things that I'm seeing at this time of year. Allergies and asthma, always definitely a big deal. But the good news is that it's getting a little bit, as the weather gets more temperate, things are starting to cool down a little bit. But now that school started, I'm about to see it bump right back up. So that's always going to be a fun thing. But just make sure that you're not discounting any minor thing. Contact your physician to see if there's any cause or concern for COVID testing. Don't downplay anything. Patients tend to do that quite often. However, I think it's getting back to business as usual, which is a good thing.
Joined by Dr. Jamie Taweel from Grand River Medical Associates. Dr. Taweel, anything else for us today before we let you go?
Stay safe out there and maintain healthy lifestyle as best as possible. Thank you very much.
grandrivermedical.com for more information. That's grandrivermedical.com. Appreciate it, Dr. Taweel.
Thank you so much.